Welcome back. Students are being urged to continue observing COVID-19 safety measures as they will be returning to the institutions of learning. Higher Health says this might assist in curbing the spread of the virus. Experts fear that the country might experience a third wave of infections. To discuss this further, we are joined by Higher Health's Dr. Ramnik Aluwalia. Very good morning to you, Doc. I just want to talk a little bit about your concerns with regard to the return to campuses and residents in tertiary institutions. You are more concerned about certain cluster outbreaks.
So, Nandi, the reality is, this is a very tricky time for us. We are in induction month, orientation period. The first years are joining inside our campuses. I just wanted to apologize, because when we were first years, when we join our institutions of higher learning, whether it's a university, a TVET college, or a community college, wherever we are, we'd like to mingle, we make friends. It's an unbound freedom coming out of parental controls, early adulthood. And now in this COVID period, what we're experiencing is some super spreader events, some parties, and they're living in congregate setting in our residences. So some people go for parties together, some students mingle with each other, bring the infection, and it goes like wildfire into many other young people, and then they go back to communities, they go back to their families. And it's Easter now, as we've started seeing pockets of cluster outbreaks in few of our universities, to some of our students. In this orientation week, now it reminds us what happened in October, November, when the post-metric rage parties happened in Belito, where lots of young people congregated together, and a super spreader events caused a massive second wave, which we battled so difficultly. So we're in the similar picture, and I think these cluster outbreaks that we are seeing among many students becoming positive through our residences, through our campuses, is an indication that this virus has a very high affinity to young people, and young people can serve as a severe carrier to spread this infection into a third wave. And that's what our warning is.
And that's one thing that we need to remember, because while we've seen COVID-19 be mostly detrimental towards the elderly, we're seeing more and more different variants that have a high affinity towards the youth, and that is the big concern here.
Absolutely. I mean, the science is clear. The global data is clearly showing. If you look at the data now in India, how the second wave is moving in, if you look at US and France and Europe, the young people now have a very higher affinity to this virus. In fact, if you look at South African data, the age group between 21 to 30 is the highest who becomes positive for the virus. The second age group is 31 to 40. So you can see this adult, early adult, and the youth is where the focus of the virus and its affinity is. And what they do is they are very able to fastly spread among each other. And when they go back into the families, into the communities, they also end up spreading into older people who have high fatality or high morbidity to this infection. And that's exactly where the challenge is. And that's exactly how the second wave started, with clusters of rage parties, a cluster of young people, where social compact and behavior didn't work for us, led into settings of congregate where residences, people in homes, people in families, and then one after the other, and then a massive fire like a second wave. And that's exactly how waves move. So young people will play a very significant role eventually if we have to fight coronavirus in any part of the world, not only just South Africa.
And it is likely that we will have that third wave. So what kind of work are you currently doing to try and have some kind of control on these outbreaks on campus and your institutions?
So I think what we've done is we've got cluster investigation teams. We built a cluster investigation, a cluster outbreak protocol, which is step by step for every institution to understand how to break the chain of the cluster. So the only way we can win this cluster outbreak is if you have, say, 60 students who become positive at the same time. That's a cluster. And in the same residences, or in around 10 or 12 residences in the same university, then there are contacts that we need to trace very quickly. So the local Department of Health, National Health Laboratory System, NICD, WHO, with Higher Health, form an investigation team. So what we do is we start, so the whole Saturday, the whole Sunday, this last weekend, we were doing contact tracing screening people. Over 300,000 young students were screened. And the aim was to test as many as early as possible, work with laboratories to say how we can reduce the time span of the results so that when we can get results much quicker, we can start isolating people and moving students into quarantine who start becoming positive and removing the contacts into isolation. If we do that very quickly, we break the chain of the virus. We break the chain of the spread. And that's exactly what we're doing. And the work is not completed yet. But since the weekend till even now as I speak, the local authorities, the teams are right stationed around these residences. It's intense work of contact tracing. And the fear is that we might miss some contacts still during this. And the challenge was Easter weekend when people are going home. So we have a possibility of missing some young people into the families and communities who might be in highly contact with a cluster of a lot of people who became positive at the same time. So the aim of the message is to please inform young people to say, who are going back from your residences, when you're meeting your family, the distancing, the mask, it's very important because there are people who are extremely vulnerable and unknowingly you might be carrying this virus to them. Yeah. So I think Easter weekend has made a huge challenge to us when before a weekend we started seeing these clusters of pockets of infections building up among young people.
Yeah, it is definitely a more crucial time than ever to ensure that we do remain vigilant. Thank you so much, Dr. Ramnik Aluwalia, CEO of Higher Health.